There is no planning before getting pregnant. So you will get unwanted pregnancy obviously. और अगर वो बच्चा सक्सेसफुली डिलीवर हो भी गया तो उसको इतनी अटेंशन नहीं मिल पाएगी क्योंकि दैट इज़ एक्चुअली एन अनवांटेड प्रेगनेंसी. सो फैमिली प्लानिंग इज़ नेसेसरी. फ़र्ज़ करें आपकी फैमिली में बच्चों के अंदर थैलासीमिया रन कर रहा है, डाउन सिंड्रोम रन कर रहा है, कोई भी क्रोमोसोमल एबनॉर्मलिटी वट एवर इट इज़, सम पैथोलॉजी इज़ रनिंग, द क्रोमोसोमल जेनेटिक एबनॉर्मलिटी इज़ रनिंग इन द फैमिली. You should be very careful. And if despite of this condition, this fact that you know that something bad is running in the family, the chromosomal abnormality or whatever running in the family, उसके बावजूद भी अगर आप फैमिली प्लानिंग नहीं करते और फिर प्रेगनेंसी होती है, बच्चा डिलीवर होता है, तो ज़ाहिर सी बात है वो हाई रिस्क होगा और दैट प्रेगनेंसी विल बी अनवांटेड प्रेगनेंसी. What about this number 2 pillar, the antenatal care? एंटीनेटल केयर बेटा बहुत ज़रूरी है. अगर आप सेफ सक्सेसफुल बेटा प्रेगनेंसी होती है, सेफ सक्सेसफुल इंटरकोर्स होता है, उसके बाद प्रेगनेंसी अटेन होती है, फर्स्ट ट्राइमेस्टर, सेकंड ट्राइमेस्टर. लेकिन सबसे ज़रूरी बात यह है कि एंटीनेटल केयर आप देखें जितनी इसको मैं थोड़ा सा यहाँ पे एंटीनेटल केयर सबसे पहली चीज़ जो होती है वो ऑब्वियसली सेफ सक्सेसफुल इंटरकोर्स, और इंटरकोर्स के बाद देन स्टार्ट्स आफ्टर अ टाइम द प्रेगनेंसी, द कम्स द फर्स्ट ट्राइमेस्टर, comes the second trimester, comes the third trimester, right? और उसके बाद obviously period of delivery. So this period is the, I should say, time where you receive the antenatal care. Okay, and receiving antenatal care is really necessary to prevent an early detection of the problems in the pregnancy. If let's suppose you had successful intercourse and then develops the pregnancy, and if let's suppose that pregnancy, that baby have some problem, maybe some genetic mutations or the genetic disease that he or she may be having, so antenatal care is very necessary. अगर वो नहीं होगी तो फिर उस प्रॉब्लमेटिक जो प्रेगनेंसी है उसको डिटेक्ट कैसे करेंगे? जब डिटेक्ट नहीं होगी तो प्रिवेंट नहीं होगी. ठीक है. सो एंटीनेटल केयर इज़ वेरी नेसेसरी. सो इफ़ यू आर प्रेग्नेंट, go to your hospitals, go to the primary health centers, visit your gynecologist and have the antenatal care to detect if there is any problem in the pregnancy, and if there is problem, go for prevention. Okay, then after this comes the delivery beta, and it should be the clean safe delivery. ऑब्वियसली क्लीन सेफ डिलीवरी, क्लीन इन्वायरमेंट होना चाहिए, क्लीन प्रैक्टिस होनी चाहिए, क्लीन जो है वो इंस्ट्रूमेंट्स होने चाहिए ताकि कोई ऑब्स्टेटिक कॉम्प्लिकेशंस ना हो, कोई इन्फेक्शन ना हो. कम्स नंबर 4 पिलर इज एसेंशियल ऑब्स्टेटिक केयर. एसेंशियल ऑब्स्टेटिक केयर का मतलब ये है कि अगर कोई कॉम्प्लिकेशन लेट सपोज होती भी है ड्यूरिंग द डिलीवरी और द प्रेगनेंसी, तो उसको मैनेज करने के लिए आपके पास इफ़ेक्टिव मेथड मौजूद हो, और you should be very much good in managing that complication. So this is what we call the essential obstetric care. We'll talk about these 4 pillars in the detail as well, but yeah, let's go a little ahead. The foundation of these 2 pillars, antenatal care and the clean safe delivery, is the basic maternity care. Basic maternity care. Obviously, if you understand, family planning and the essential obstetric care is something very different. Family planning is what you do at your home. Essential obstetric care that will be looked after in the hospital, in the primary health care. But look, antenatal care and clean safe delivery, it is the basic maternity care that should be given to every pregnant woman, every mother. Antenatal care and the clean safe delivery. Basic maternity care is actually the health care services which is provided to women. If you are a pregnant lady, you should do at least 8 to 10 antenatal visits. At the time of the delivery, it should be very much clean, very much safe. The foundation of these 2 pillars is the basic maternity care. If there is no basic maternity care, these pillars will be no more. And for all these 4 pillars, there are 2 very important foundations. One is the primary health care and one is the equity for the woman. Primary health care that will not only give you the antenatal care, at the time will not only give you the clean, safe delivery, the primary health care also have ability to, they also have the essential obstetric care, because primary health care have got the system to prevent the complications of the, delivery and the pregnancy. Also for family planning, you can go to the primary health care centers and discuss with your doctor, right? And there should be the equity of the woman. Equity for the woman is the really important foundation for all the pillars, right? Equity refers to something referring to the need based thing. If somebody comes to you with more severe complications, and there is another person with less severe complications, so there should not be equality, but there should be equity. जिसको ज़्यादा ज़रूरत उसको ज़्यादा provision, right? So this is I could deliver in this part. There are 4 pillars and some foundation of the safe motherhood. The same thing is written down here. You can see the family planning to reduce the number of the high risk and unwanted pregnancies. Obviously, antenatal care very much necessary for the prevention and early detection of the problems in the pregnancy. Clean safe delivery ताकि obstetric complications ना हो. Essential obstetric care ताकि अगर कोई any obstetric complication होती भी है तो उसको timely इफ़ेक्टिवली उसको मैनेज कर सकें. ठीक है बेटा, इस तरीके से. Now onward, we'll discuss the family planning, and I mean to say I'll discuss all the pillars of the safe motherhood. One is the family planning.